Maria Gillum-Krakauer. I'm an assistant professor of neonatology at Monroe Carroll Jr. Children's Hospital at Vanderbilt in Nashville, Tennessee. In this module, we will discuss the oxygen dissociation curve. Goals for this module are for you to know how the properties of hemoglobin affect oxygen uptake and delivery. Hemoglobin is found exclusively in red blood cells, and its main function is to transport oxygen from the lungs to the capillaries of the tissues. There are several properties of the hemoglobin molecule that affect oxygen uptake, transport, and delivery. We will discuss the effect of carbon monoxide, pH, carbon dioxide, and 2,3-diphosphoglycerate. These can be summarized by the oxygen dissociation curve. On the x-axis, we have the partial pressure of oxygen, and on the y-axis, we have the percent saturation with oxygen. Note that the oxygen dissociation curve for hemoglobin is sigmoidal in shape. This is because the subunits cooperate in binding oxygen. It is difficult for the first oxygen molecule to bind, but subsequent binding of oxygen occurs with high affinity. The affinity of the hemoglobin for the last oxygen bound is 300 times greater than the affinity for the first oxygen bound. This can be visualized in the oxygen dissociation curve as the steep upward part of the curve in the region near 20 to 30 millimeters of mercury. The blood is almost completely saturated at a PaO2 of 90 to 100 millimeters of mercury. This cooperative binding of oxygen is important because it allows hemoglobin to deliver more oxygen to the tissues in response to relatively small changes in the partial pressure of oxygen. Contrast this to the oxygen dissociation curve for myoglobin. Myoglobin has a higher oxygen affinity than does hemoglobin. The partial pressure of oxygen needed to achieve half saturation of the binding site, called the P50, is 1 millimeter of mercury for myoglobin and 26 for hemoglobin. Myoglobin has a hyperbolic shape, which makes sense if you think about how myoglobin is designed to bind oxygen released by hemoglobin at the low PO2 found in the muscle, and then releases oxygen within the muscle cell in response to oxygen demand. It is helpful to understand myoglobin because hemoglobin acts a bit like myoglobin when carbon monoxide binds to it. When carbon monoxide binds at one or more of the 4 heme sites, hemoglobin shifts to the relaxed conformation. This causes the remaining heme sites to bind oxygen with high affinity. Carbon monoxide shifts the oxygen curve to the left and changes the shape of the curve from the typical sigmoidal shape to a hyperbola. The affinity of hemoglobin for carbon monoxide is 220 times greater than for oxygen. Even minute concentrations of carbon monoxide can produce toxic effects in the blood. The second and third effect that we'll discuss in this module is that of pH and carbon dioxide. Hemoglobin has a decreased affinity for oxygen when the pH is lowered, more acidotic, or in the presence of an increased partial pressure of carbon dioxide. This shifts the oxygen dissociation curve to the right. This is called the Bohr effect. Raising the pH or lowering the concentration of carbon dioxide results in greater affinity for oxygen and a shift to the left in the oxygen dissociation curve. When the pH is lowered, more acidotic, hemoglobin releases oxygen more readily. The pH is generally lower in the tissues than the lungs. This differential pH gradient allows hemoglobin to be an efficient transporter of oxygen, favoring unloading of oxygen in the peripheral tissues and loading of oxygen in the lungs. The final effect on oxygen affinity that we'll discuss in this module is that of 2,3-diphosphoglycerate. It's also called 2,3-bisphosphoglycerate, 2,3-BPG, or DPG. Don't get confused, they are all the same thing, just slightly different names. It is the most abundant organic phosphate in the red blood cell and present in about the same concentration of hemoglobin. It is an important regulator of oxygen binding to hemoglobin. 2,3-DPG binds in a cavity between the beta chains and stabilizes the deoxy form of hemoglobin, thus decreasing oxygen affinity. This shifts the oxygen dissociation curve to the right and allows hemoglobin to release oxygen efficiently at the partial pressures found in the tissues. The dissociation curve for fetal hemoglobin is shifted to the left compared with adult hemoglobin at any PaO2 less than 100 millimeters of mercury, meaning that fetal hemoglobin binds more oxygen. This is because 2,3-DPG binds less effectively to the gamma globulin chains and can't decrease the oxygen affinity of fetal hemoglobin to the same extent as adult hemoglobin. Concentration of 2,3-BPG in the red blood cell increases in response to chronic hypoxia, such as with chronic lung disease or living at a high altitude, or chronic anemia. In this module, we discussed how the properties of hemoglobin influence oxygen uptake and delivery. This concludes Module 2. Thanks for your attention.